Normative ethics in healthcare. When healthcare professionals ask ethical questions, they are usually not asking abstract philosophical questions about the nature of morality itself. They are asking practical, action guiding questions. What should I do? What is the right course of action? What is morally allowed, required, or forbidden in this situation? Normative ethics is the branch of ethics that addresses exactly those questions. Normative ethics is concerned with establishing the moral norms, principles, and guidelines that govern ethical behavior and decision making. In healthcare ethics, normative ethics provides the frameworks used to evaluate actions, justify decisions, and guide professional conduct in clinical practice, research, and policy. Unlike metaethics, which examines the meaning and status of moral claims, normative ethics is action oriented. It seeks to determine what healthcare professionals ought to do when faced with ethical dilemmas involving patients, families, institutions, and society. In healthcare settings, normative ethics plays a central role because clinical practice is inherently moral. Decisions about treatment, consent, risk, resource allocation, and end of life care are not morally neutral. They require judgments about right and wrong, benefit and harm, obligation and permission. Normative ethics provides structured approaches for making those judgments. It asks whether an action is morally permissible, morally required, or morally prohibited. These categories matter deeply in healthcare, where acting wrongly can cause irreversible harm, and acting rightly can preserve dignity, trust, and life itself. The major ethical theories studied in healthcare ethics, such as consequentialism, deontology, virtue ethics, principlism, and natural law theory, are all forms of normative ethics. Each offers a different account of how moral norms should be established and applied. Some normative approaches focus on outcomes, asking whether an action produces good consequences or minimizes harm. Others emphasize duties, rights, or rules that must be respected regardless of outcome. Still others focus on moral character, professional virtue, or alignment with objective moral goods. Normative ethics does not eliminate disagreement between these approaches, but it provides the intellectual tools to evaluate them. In your healthcare ethics framework, normative ethics is what makes ethical reasoning possible at all. Without normative standards, there would be no basis for ethical critique, no way to distinguish better from worse decisions, and no justification for professional accountability. Consider informed consent. Normative ethics tells us that respecting patient autonomy is not merely polite or efficient, it is morally required. Consider non-maleficence. Normative ethics tells us that causing unnecessary harm is morally forbidden, even if harm might be expedient or profitable. Consider justice. Normative ethics tells us that unfair distribution of healthcare resources is ethically wrong, not just unfortunate. Normative ethics also explains why healthcare ethics education emphasizes ethical reasoning rather than rule memorization alone. Guidelines and policies are important, but they derive their authority from deeper moral norms. When policies conflict or fail to cover a case, clinicians must reason normatively to determine what ought to be done. In clinical practice, normative ethics often involves balancing competing moral obligations. A clinician may face tension between respecting autonomy and promoting beneficence, or between individual patient needs and population-level justice. Normative ethics does not promise easy answers, but it provides a disciplined way to justify decisions rather than relying on instinct or convenience. Importantly, normative ethics recognizes that ethical decision-making is context-sensitive. Moral norms are applied within real-world constraints, uncertainty, and human vulnerability. This is why ethical justification matters as much as ethical intention. Healthcare professionals must be able to explain why a decision is ethically defensible, not merely assert that it feels right. Normative ethics also undergirds professional responsibility. Healthcare professionals are not free to act solely on personal values. By entering a profession, they accept shared moral norms that govern practice. These norms define what counts as ethical care and establish standards against which conduct can be evaluated. At the same time, normative ethics does not imply moral infallibility. Ethical reasoning is often difficult, especially in cases involving tragic choices or competing goods. Normative ethics allows for disagreement while still affirming that ethical questions have meaningful answers that can be argued for, criticized, and refined. In your healthcare ethics text, normative ethics functions as the practical heart of ethical analysis. It connects ethical theory to clinical action. It explains why ethical decision making is not optional, subjective, or merely administrative, but a core component of professional competence. Understanding normative ethics is essential because it clarifies what healthcare professionals are morally accountable for. It affirms that ethical practice is not just about following rules or avoiding lawsuits, but about acting in ways that are genuinely right, justified, and worthy of trust. Normative ethics reminds us that healthcare is not only a technical practice, but a moral one that requires ongoing reflection about what ought to be done when human well being is at stake.